play lead guitar, if you're curious, and Mike Kuykendall is our bass player. It's a lot of fun, actually, and I think really what keeps us healthy in the jobs that all of us in this room do is having balance in our lives and healthy pursuits outside of work, because you can get very cynical sometimes when you're engaged in the work that we do here, because sometimes you feel like you're beating your head against a wall and the wall never moves, but your head gets very sore. So with that, I wanted to give a little bit of history about who I am so you understand where I came from, and talk about my early days in police work so you have some context for where we're at right now. I grew up in Portland. I went to public schools in North Portland, Roosevelt High School, Portland State. I have a degree in psychology, and I went back and got my master's in public administration. And really love this area, have been committed to the Portland area for a long time. After college, I started working in social service, and I worked for the Boys and Girls Clubs of Portland. Absolutely loved working with kids and being in a great organization. Worked at the Lentz Boys and Girls Club in Southeast Portland with a very tough population of kids, a lot of latchkey kids at that time that would come into our club every day after school, and we were it. We were the ones that provided a safe place for them, programs that helped them build self-esteem and confidence in what they were doing. Eventually, I went from counselor to program director to director of the facility, and started looking at being a executive director of Boys and Girls Clubs, but it would have required a move out of Portland. This is where my family and my roots were, so I didn't want to leave. So I started looking for a different profession. And I happened to see an ad in the newspaper for the Multnomah County Sheriff's Office, and I had taken some criminal justice classes in college. I thought, that sounds really interesting. And so I started going through that process, and eventually it takes a while to get hired in law enforcement work. And after about 7 months, they hired me at the Multnomah County Sheriff's Office. And after I completed our, we go through this training at the state academy, and then we go through a probationary status on the road. And I was a little older than most of the deputies that were brand new. I was 32 years old, and I'd grown up in North Portland. And so I went out to the Columbia Villa as part of my initial training with the Police Bureau, and we had a very unique program called the Safety Action Team. And out at the Villa, we had partnered police and social service providers to deal with some really tough issues in a very large community out there around Columbia Villa. And at that point in time, Columbia Villa was controlled by the Columbia Villa Crips. And it wasn't a safe place for the social service providers to do their work, and it wasn't a safe place for the residents to do theirs. And the Sheriff's Office came in with a very unique program to make that community safe so that the social service providers could do their good work. And in very collaborative fashion, we made a world of difference. And I learned firsthand early in my career what community-based policing was, because that's what we were doing. It worked. And we created safety action teams in Rockwood and David Douglas, and I worked on both of those. And then just back in 1992, 93, there were a lot of annexations going on, a lot of controversy about that area of Mid-Multnomah County being annexed. The Deputy Sheriff's Association was worried about jobs and things of that. So I was the deputy that I did an initiative petition to take over the Portland Police Bureau. And so we got 44,000 votes from citizens saying this is an idea that we want on the ballot, and we needed 40,400. So we missed getting it on the ballot, and I thought then that area of Mid-Multnomah County got annexed, and I thought, well, if you can't beat them, you better join them. So I had the opportunity to come over to the Portland Police Bureau and join a really great organization. I started as a sergeant out at North Precinct back in my community, knew a lot of folks and issues out there, felt very comfortable working there. Became a lieutenant, worked at the Transit Police Division, and then back again at North Precinct for a while as a patrol lieutenant. And then I was put in charge of our CERT and bomb team in Tactical Operations Division, and then was promoted to captain in 2004. Worked in the Drugs and Vice Division at a time when meth labs were really overtaking our community, and saw that we were our ability to do narcotics investigations, which drive a lot of our crime, was limited because we were going out and doing all these cleanups with meth labs. And again, you have these epiphanies every once in a while, and the governor did something that changed the environment for us with the changes to the pseudoephedrine restrictions. And at that time, we had all these mom and pop labs where people would go in, buy packages of pseudoephedrine, take the capsules apart and then convert that to methamphetamine through this chemical process that would contaminate homes, apartments. We had children living in these toxic environments. You put restrictions on it, and all of a sudden, all of those labs went away. We had 114 in 2004, and I think we had 5 the next year. And it changed, that low-hanging fruit, making a little simple change like that, allowed us to go back to work as narcotics investigators. And while there's still a drug problem and a meth problem, there isn't an issue with those toxic environments and our children growing up in our community. Then in 2006, Rosie asked me to be the commander of Central Precinct, and again, I was very honored and humbled to have that opportunity to serve downtown. We have a wonderful and vibrant downtown area. I live in Southwest Portland, so I'm really committed to our community. My kids go to school in the Wilson District, and so I want to make sure my kids are safe and your children are safe. It was a great opportunity to work in a very collaborative fashion with the business community and social service providers and police. We did some remarkable work. I think crime went down about 35% over 5 years as we made some changes to how we were doing business. We started looking at long-term ways to reduce the impact on crime rather than just displace it or put a Band-Aid on it. We started doing innovative programs like the Service Coordination Team, where we got people into treatment and housing and out of jail. And certainly we held them accountable. Part of that program, what makes it work is that you're holding people accountable with short periods of incarceration, but you're looking at the underlying cause of why they're stealing everything that's not nailed down, and it's drug addiction and sometimes mental health issues. So we did some good work there. In January of last year, I started East Precinct, and then May 11th, I got a call from the mayor, and he actually met me down here in this building, and we had a conversation about what he asked me what my thoughts are on the future of the Portland Police Bureau, the direction we needed to head, and we talked for about an hour, and at the end of that hour, he said that the next day was going to be replacing the chief of police. That was very shocking. Certainly Rosie had been a mentor and a friend and a good chief, but she and the mayor had a disagreement over the budget, and he was going to make a change, and so he asked me if I wanted the interim job as chief, and I said no, because there would be people in the organization running for the job at the same time. A lot of us knew that Rosie was going to retire and there would be a competitive process, and people in the organization were preparing for that, and I certainly didn't want to lead the organization as an interim with people in the organization going to vie for that job. And then I told him, well, I think all chiefs are interim in Portland. He laughed, and later that night called me and said that the next day he was going to make a change and would I be the chief of police. And I can tell you, while it was sudden and it was shocking, it has been a very humbling experience, and I really feel very blessed to have the opportunity to serve you. We live in a great city, and I'm going to do everything I can to make our police bureau the very finest in the United States. So that's kind of me and where I've come from and how I got to this point. And I touched a little bit about where I started back in 1989 when I was a brand new police officer. At that time in Portland, we lived in a different city. Violent crime was spiraling out of control. Our crime rate was headed to all-time highs, which we hit in about 1994. Criminal gangs like the Crips and Bloods controlled neighborhoods in our city, in North and Northeast Portland. Every night there would be shots fired calls, and there were so many that the police bureau didn't have the resources to go to all of them. We would only go if people were hit or there was property damage. The others were just put out as information. It was a time when you couldn't walk a block in Old Town Chinatown without somebody trying to sell you cocaine or heroin. And again, there was not much accountability in the criminal justice system. People that were committing violent crime would often get released after a few years in custody. It was pre-Measure 11. I think it was also the advent of community-based policing. And I think through our good work with the police and the community, we've changed things. And we now have one of the safest cities in the United States. Forbes magazine does some ratings around public safety. And last year, we were the second, in terms of overall safety, we were number 2 of all of the major cities in the United States. That's pretty remarkable. We have a very safe city. And while you would think we'd be celebrating our successes as a police bureau and as a community, instead, I think, in no small measure, we've had a fracture in community trust between the police and the community we serve. And a lot of that has to do with the new work that the police are finding themselves involved in. When I came on, it was about violent crime, violent gangs, and really some very severe public safety issues. Now our officers are dealing with social disorder, and the things that we're asking them to do are really problematic. Our officers are dealing with homelessness. We ask them to go out and move people out of transient camps. They're dealing with mental illness. We are asking our officers to be first responders to situations involving people who are often severely mentally ill. We have protests and demonstrations. We're working a lot with people who are drug addicted or have alcohol issues. And those are societal problems that all of us own, and yet we've placed the burden, I believe, on our law enforcement to deal with it. And it's very hard for them. I think the management of the police bureau has to provide them some guidance. It's pretty tough to tell an officer to go deal with somebody who's under a bridge sleeping. You want them out of the park. The Parks Bureau asks us to move them. It has an impact on downtown, the perception of public safety. And yet, when that officer interacts with that person, they don't know what they're going to get. Is that person going to comply with them? Are they going to become violent? Are they going to pull a knife out? And how does that play in the media the next day when you have an officer involved in an incident and we're trying to simply move them out of a transient camp? Those are very, very difficult situations for us. Certainly, we've tried to adapt to that new environment, and we're doing some very innovative things around this social disorder. I mentioned the service coordination team, where we've identified the most frequent flyers, the people that were stealing everything that's not nailed down to support their drug addiction. They were generally doing that in our downtown neighborhoods because you have a lot of victims, people who park their cars and unfortunately leave laptop computers and purses and change and things like that in their car. And so we were getting a lot of car prowls, and then those people would turn that property into dollars and then go buy crack cocaine or heroin or meth. And so we identified the frequent flyers, people we were constantly cycling through the system, because with drug addiction issues and low-level criminal behavior, there aren't a lot of sanctions and a lot of options. We do pretty good with violent crime. If somebody commits a murder, the system works pretty well. But with low-level offenders, particularly ones that have drug or alcohol or mental health issues, the system doesn't work very well. So a lot of these folks were just cycling through. We were arresting them maybe 30 times in a 3-month period, and they're just back on the street again. So first thing we had to do was identify them. Second thing we did is we brought in all of our partners. So folks like Central City Concern, Transition Projects, Join, Cascadia, Project Respond, Multnomah County Sheriff's Office, and we said, what can we do about this group? If we can't make the system work for everybody, what can we do around these people right here, this 100 or 150 that are really causing our crime rate to spiral out of control. So we came up with some pretty innovative strategies. We found that short periods of incarceration, so getting the jail to actually hold people for 3 days, that was, a few years ago, that was a tough thing to do. The jail was full. There weren't jail beds. It took, the sheriff had to act with good faith to say, you know what, for those folks, we're going to hold them in jail until arraignment. And the judge has an opportunity to see what are the underlying issues and maybe have a sanction or at least figure out what's going on in that person's life. Again, with a lot of these folks, drug and alcohol issues. So we had treatment through CODA at first. We cobbled together a couple beds here and there to get people into treatment. And then most of them were homeless. They were living on the streets of downtown Portland. And so contracting with Central City Concern to provide housing. That went, it went so well. In fact, in that group, we reduced recidivism in terms of their crime with those categories that we were looking at by 80%. And we saw some really remarkable successes overall with that cohort. So the city started putting more and more money towards it. And now we put about almost $2 million towards drug treatment programs. So we've got VOA doing our drug treatment now, and Central City Concern doing our housing. We needed a deputy DA to handle the cases and a probation officer, so we were paying for that out of the money. It worked very, very well. So we're taking that model now, we're adapting it to what we're doing around mental health. I wanted to give you just a little bit of an overview of where we're having issues with that, and then talk about some of the numbers, and then maybe some options that we're looking at, and then kind of close with an overview of the officer-involved shootings we've had and why there's an intersection between those and mental health issues. So mental health, more and more of our officers are encountering people who are either in emotional crisis. There's some event in their life that's driving them into crisis. It could be unemployment, it could be divorce, or we're seeing people who are mentally ill. And you are the experts, I'm not. So if I use the wrong language, please forgive me or raise your hand and tell me use this instead. But our officers are really encountering a lot of people who are suffering from some sort of mental health issue. And it's complicated by the fact that a lot of these people are self-medicating. They should be on probably some sort of drug to help them with their mental health issue, but instead they're living on the streets and they're self-medicating with alcohol or crack cocaine or marijuana or something else. So that's what we're encountering, and unfortunately we're seeing a lot of those folks. We haven't studied the entire context of it, but we respond to over 400,000 citizen contacts every year. Out of that 400,000, we think there's about 3 to 7% that are driven by mental health issues. So that at the low end, that's 12,000 calls that our officers are having interaction with someone who has an underlying mental health issue. That's a lot of opportunity for failure. And the safety net that used to exist that helped folks in that crisis isn't there anymore. You probably know that better than I do if you work in the social service field. That's been defunded. Changes in state law have impacted what we can do. We've seen folks that we've taken off of the balcony of the Marriott. Please, Beth, jump in if I get it wrong, the story wrong, but we had a man standing on the balcony of the Marriott for hour after hour, threatening to jump, gaining, I don't know if you want to call it courage, but gaining that ability to end his life. We spent hours, and we had our CERT team, our hostage negotiation team there, command staff, all working to save this one person's life. We eventually tricked him off of that ledge and then rushed him and were able to get him to a hospital. And by the time he got in front of a judge, of course, he has been in treatment for a few days and presents himself very well, and he was released back on the street. And so our ability to hold people and get them help is very limited. And did he eventually commit suicide?
No, not
Okay.
that I know. But
All
then
right.
I don't follow, like
All of that. But it's very frustrating. I know Lisbeth was part of the team that went to court to try and get him a longer treatment stay, and it didn't work. And some of that is just around, we've had court decisions that have made it very hard for judges to hold people to get them help. And so that's where kind of the police bureau's at. And we did some analysis about calls for service involving people in a mental health crisis or welfare check. We respond to those about once an hour, 365 days a year. So that's a lot of opportunity for failure. And we're doing everything we can to have successes. We're looking at innovative programs like our mobile crisis unit, where we've paired a police officer with a project respond worker. They're identifying the people who are the frequent flyers in the criminal justice system that also have mental health issues and maybe at high risk to have an outcome with the police that we don't want. And they're trying to get at the front end of that and get that person back into treatment or back on medication or back in a supportive environment so that we don't have those frequent contacts with police. We've identified people that have high frequency with the police and are at high risk. And then we've also got people who are high risk but low frequency. We don't see them very often, but when we do, it's a terrible crisis. And that leads me up to kind of where we're at with our officer-involved shootings in the last year. Certainly, in the last 2 months, we've had too many. And it is, I say that not that the officers are doing things that they shouldn't do. They're protecting themselves and the community. But it takes a terrible toll on the community. It takes a terrible toll on us. And these are events that we want to, at the front end, if we can intercede and get that person help or find better tools or tactics so that our officers aren't put in the position of having to use deadly force to protect themselves or the community, we want to do that. Looking at the last year, I said, we had analyzed the heck out of these things. We have detectives that do the criminal investigation, and then we have our internal affairs look at it. We have our training division look at it in terms of tactics and did the officers do the right thing or were there other options. Grand jury reviews it. Then the command staff reviews it. We have peer groups that review it. Citizens sit on that board that ultimately makes decisions about right and wrong in terms of the officers' actions. That takes about a year typically with the process we go through. And I just said, we can't wait a year to look at the last group of shootings. And so our training division and strategic services division have looked at them to see if there's some common denominators amongst these shootings, and then what can we do? Is there low-hanging fruit that we can do, that we can go at right now? Are there groups that we should be bringing in as stakeholders to help us? So I wanted to kind of brief you on this, and this is brand new. Mike and I were at a briefing at 11 o'clock today with the training division and strategic services, so you're hearing it before anybody else in our organization. And I'll just briefly tell you that we had 8 shootings in the last 12 months. Out of those, all but one were self-initiated. I mean, were dispatched. So out of those 8 calls, 7 of them were officers were dispatched to an event. So there's somebody already threatening or creating a disturbance or involved in something that the police are being sent to. And of those 8, 6 of them involved a subject threatening or assaulting another citizen. And I would say that in one of the 2 that wasn't, that person was on our DV high violence caseload. This person was at high risk to kill his girlfriend and had been identified as a DV, we call it DV divert, somebody that our domestic violence division was looking at. All of the folks involved had been listed as suspects in a written criminal report at some point, so they were in our system in a criminal report. 7 of the 8 subjects had police contacts involving alcohol or marijuana. The one person that didn't had it in their system, but had never had an official police contact about it. So again, that's that intersection between possible mental illness and alcohol or marijuana. And I'm sure that makes it very difficult for us and you to help them get treatment. Of the 8 cases, 7 of them probably the person had some underlying mental illness. Now, would they be classified, I'm going to throw out some lingo that our sergeant gave me, as severe and persistent mental illness, the SPMI, 1. The others had some level of mental illness, but wouldn't have been classified in the system as SPMI. So again, there's folks out there that have issues, but we don't know about it probably in your data system or in ours. But 7 of the 8 appeared to have connection to mental health crisis, and in 5 of the 8 incidents, officers tried to use less lethal. They tried de-escalating, and that didn't work. The less lethal options didn't work. And that's not to say our less lethal options don't work. They do actually in the majority of cases. Probably 75% of the time we use tasers, it's very effective. But in these cases, it wasn't. And I don't want to leave you with the impression that less lethal isn't effective. It is, but not always. It's not just a full fail-safe system. All of the subjects involved were armed with weapons. They either had them on them or in one case had it inside the apartment. Again, we looked at, with these cases, there was a combination of mental health issues, substance abuse, and weapons. That's those 3 things, recipe for disaster. So when we were looking at what we can do to help officers, if we are going to calls for service, I want our dispatchers to start asking really good questions about those 3 things. And if we have that information, our officers need to know it, because that's a recipe for us to have a bad outcome. Again, we're looking at high-risk, high-frequency people, identifying folks that are frequent flyers in the system, and then looking at the folks who are high-risk but low-frequency. We don't see them very often, but when we do, they're in crisis. And if we can identify them and get our mobile crisis unit or other help out there, Project Respond, that may avert that disaster. A lot of these folks, they are cycling through the system. They're coming in on really low-level misdemeanors. They're coming in on alcohol abuse. A lot of them are the high-frequency, high-contact folks are in there because of alcohol and marijuana issues. So we're picking them up because of open containers of alcohol or things like that. And they're just kind of cycling through the system because they're just at that low level. Again, that's an opportunity for us maybe to intercede at a lower level before they spiral out of control, and we're in a situation where they're harming somebody in the community, or officers are having to use force to take them into custody. So that's kind of what I wanted to talk to you about, and kind of open up the door for conversation.
Before you do that, I wanted to introduce Elizabeth Garretson, who's with you today, and actually give her a chance to come up and help answer questions, if that would be helpful. She currently works for the Bureau, where she coordinates the Crisis Intervention Team Program. In that role, she provides 40 hours of training for patrol officers and sergeants that focuses on police interaction with people in crisis, with special emphasis on people who suffer from mental health disorders. She also works for a mobile mental health crisis team that responds to mental health emergencies. But before we start, I want to really thank you for a very sensitive subject and very forthright, and we really appreciate you being with us today. Let's get to it. So, questions?
Again, I think our department is on the cutting edge. And I know you've seen maybe something different in the media, but we are trying things that are innovative. We're not waiting until we have all the answers. If we have things that we think are going to work, we're going to try them. And a lot of the reason that we're on the cutting edge is because of this person right here. I think it's pretty unusual for police departments to have someone like Elizabeth with us. It pushes us to try different avenues. I believe that if we have a better relationship with social service partners than we do with the jail, that's a positive thing, and that's where I'm driving our department. I want us to be on better relationships with you folks and Cascadia and Transition Projects than we are with MCSO. And that's not to take away with our relationship with the jail, but I think if we can bring our relationship up with social service partners, we're all going to be better, and we're going to be able to leverage resources that we don't currently leverage. So questions?
Please, can you talk about the Bazelon?
Yes. She's asked me to talk about the Bazelon project. That's a project that actually LifeWorks Northwest is part of too, and so thanks. Chris Miller is really involved. It's a project where the police, basically the Bazelon Center for Mental Health Law is out of Washington, D.C. They have 5 sites nationally, and Portland was lucky enough to be one of those 5 sites. And so what their premise is that any time that police have an encounter, unnecessary encounter with somebody who's suffering from mental health issues, that really shouldn't be happening. It's really not the job of the police. It's really the job of the rest of the service providers and the system, the social system, to do that. Now, we all know the problems with that, but that's beside the point. So what they do is use a root cause analysis methodology where you take the event. So here's an event, and police came into contact with a mentally ill person or someone who's in a mental health crisis, and then you start asking the question, why? Well, why did that happen? What happened right before that? Well, right before that, someone called 911. Well, what happened at the 911 center? Well, this happened. Well, then a sister called because she knew her brother was acting strange that morning. Okay, what resources were there? How do we know? What do we know about the person's medications? You start here and you keep asking why until you find out what is the root cause of what happened here. That same kind of analysis has been used in hospitals with seclusion and restraints to ask why are we putting people in seclusion and restraints, and have been successful to see how we can decrease those. So using that same methodology, that's what this project does. So the project has gotten together different people from all parts of the system, the Portland Police Bureau, some mental health folks, people from 911, Multnomah County Call Center, to sit in a room and look at 40 cases and take those 40 cases and say what happened here. And it's a 3-year project, and we're at the end of year 1 where we're going to start to make some we've made some analysis about why are these situations happening. There's the worker bees that look at all the cases, and then there's a next level up. That's the steering committee, who are some people who say, here's what we want to focus on. And it's a consensus building where then the community, often what happens is somebody will come in and tell a community, here's what you need to do. And the community, we have a local context. Portland is unique in some areas, and so it's the community saying, this is what we want to focus on. So that's what's happening now. It's a 3-year project. We're in year 1, and I think it should have some really interesting, hopefully, results, at least with the community identifying an issue. Where do we want to put our resources? Because they're limited, right? We have to make a choice at some point where we're going to put our focus, our energy, collectively with all the partners. I think that's the key.
Kind of question. It sounds like it's more of information. You're gathering this information.
Mm-hmm.
So you're gathering this information, but when a police officer is out doing his job, how does this officer know that there was a sister who called, an uncle who called the police and said, hey, my brother's acting strange? How does he know at that instant? How is there a plan or roadmap to get that information from that early call to that police officer who says, oh, well, this needs to be handled by someone else? How is that in work? I mean,
it's hard because we don't, your system doesn't share much information with our system. You probably have a lot of good data around somebody. We never see it, and I wish we could, but whether it's federal health law or just our different cultures, we don't often work as seamlessly as we would hope in this situation. We are, again, looking at dispatch protocols. One of the things that we can do, if we, for example, right now you call 911, the dispatcher says police, medical, fire, and then they kind of send you off. They'll ask you questions about that. What if we had police, medical, fire, and health issues? And so the dispatcher, then that opens up a whole different line of questioning, and that information goes from that dispatcher via our CAD, our computer-aided dispatch system, to the officer on a screen. Is it seamless? Communication never is. We never have enough, but at least it gets us to a better place than we are now.
I'd like to ask you a kind of a tangential question a little bit. I work at OHSU, I've been studying civil commitment for 35 years, and I know exactly what you're talking about with trying to get someone into the civil commitment system and having them dismissed. But this, I felt in thinking about this issue, and with all of the events that have happened nationally with police being the targets, and the thing I wanted to get at was guns. I mean, you're confronting situations that are really frightening to people confronting them. Do guns play a part in your thinking about going out on the street? And what's the situation in Multnomah County with guns at this point, legal and illegal guns?
Well, there's a lot of firearms out there. We have a very liberal concealed weapons permitting system, so unless you have been under the care of a physician or somehow in the system, in the mental health system, probably the SPMI, or you're a convicted felon, and everybody else can get a gun. So there's a lot of concealed weapons out there. Again, I don't know if that's a societal issue around what types of weapons should be allowed, but certainly we're seeing more and more people who are, whether they're armed with a gun or a knife, they have a weapon, they're highly motivated, and they're very, very dangerous. And that's just the reality that we deal with. Our officers are using good tactics. They're using time and distance when they can and less lethal options. But too often we're facing someone who is armed and highly motivated and intent on harming the officer or the community.
Sir, if I want to be arrested, I think I want to be arrested in Portland. But that's not what I'm thinking about. I am wondering if we don't have an epidemic, a national epidemic of security, that we are preoccupied so much that it must be stimulating to weak minds that they're somehow involved in this repeated business of being searched and examined in the airports, for one place. And have you done any thinking about how the culture has changed to this defensive sense of we are about to be attacked?
I think that's an interesting point. We haven't. Certainly, we're not unique in Portland, Oregon. I think a lot of cities and communities are facing the same issues, and a lot of it, again, we've underfunded treatment and education and prevention options on a number of levels, and we're paying a price for that now. The sad reality is a lot of the things that would help people in crisis aren't there, and we're it. And so when you call 911, you are going to get a Portland police officer. We're going to do everything we can to peacefully resolve the situation, but a lot of the things that would keep us from ever having to be dispatched on a call don't exist anymore. And some of the commitment, I'd be interested in your thoughts on the commitment law, because it seems like while very few people, as we talk about it, should be committed, the pendulum has definitely swung to, from my perspective as a community member, we have allowed ourselves to think it's okay and it's all right to treat people who are mentally ill or homeless in a very demeaning and life-threatening way. We allow them to live on the streets. We allow them to spiral down into despair without, in terms of their civil rights, without really thinking that we're allowing that person really, putting them in a position where long-term health is probably not where it should be. And part of that is just our attitudes about these issues.
We're committing about half the number of people that were committed in Oregon 20 years ago, and the population has gone up by about 1 million. And also the number of beds have been drastically reduced. So we don't have the facilities, and we keep getting, on the mental health side, they keep getting into this either-or argument. The money goes here, the money goes there, and you basically, what the police need and what the agencies on the front line need are a lot of options for dealing with cases, and you have very few options. There really are, and you know, it also, on the other hand, leads to many mentally ill people in the jails, because one of the options the officers have is to give them a charge.
That resolves, for us, that if we have a criminal charge, that resolves the immediacy of the situation. And so you're right, our jail has become our de facto mental health treatment facility.
One of the questions I have, LifeWorks Northwest, we've had the opportunity, just in the last year, I think at least 4 of our staff have been on ride-alongs through the various programs, and I think it's just been so illuminating to kind of just be there with the officer and just seeing what you guys see. I guess one of the things I would ask you is, from your perspective, how can we as the mental health community and the addiction providers better partner? Are there other things we could be doing? Because I see it as absolutely a need, all systems working together. But I'm just curious, at top of mind, do you have any thoughts about things we could be doing to?
Well, I think leveraging resources and identifying, you know, we've got to get over the despair that I think in cynical nature some of us feel that do this work, because the problem is so overwhelming. Sometimes you say, well, I can't impact it. But really, let's find out where the greatest need is. Maybe it's, we've identified the frequent flyers in the criminal justice system. When we deal with those folks, that actually opens up more resources. When we deal with them, it opens up more resources because they're using so much. So working with us and leveraging our resources and working out of those silos that we get into is one way. And then you probably see more of where we have systems failures that we could fix.
I mean, the information sharing, and I don't mean HIPAA violations, but the fact that we really sometimes don't know, you know, what happened to a person beforehand, and I don't know how to address that. We've had a lot of discussions, you know, about that, but certainly that's one of them. But I wanted to go back to something you said about how, first of all, I appreciate the question, how can mental health partner? And, you know, on a positive note, because it is pretty easy for myself to get really depressed about the situation, I recently heard at a forum that Oregon is in the bottom, I think someone said 47th state in the nation per capita funding for mental health. You all probably know that, with these agencies, right? I didn't know it was that low. Someone said it was below, you know, Mississippi or something, which I don't know why they said that, but it's interesting. So the point is, I can get pretty depressed about that. So what I wanted to say is, I wanted to thank the programs that are in place. I mean, LifeWorks Northwest runs a mobile crisis team out in Washington County, and they partner with police all the time. Project Respond here in Multnomah County has been working for 17 years partnering with police and really trying to learn each other's worlds, and so that when those incidents, when we're there at the scene and things are a little bit heated, we've got a relationship where I can say, hey, can we work on this way? Hey, how about, you know, we try this? And the police officer's talking to the mental health folks. So, I mean, there are things happening. The mobile crisis car that we're, you know, piloting and seeing, can that have any effect? So there is some the Bazelon project, the Gaines project through the county. There are some things that people are trying to do. There's no lack of trying. I'll say that, with not just the police bureau, but everybody. Judge.
I'm Judge France, and I'm a chief criminal judge, and have been involved in the intersection mental illness and public safety system for 12, 15 years on the bench, my 17 years on the bench. And we have, as many of you know, the local public safety coordinating council subcommittee that Joanne Fuller, who just changed positions, but she was the executive director of DCJ and then Department of Human Services, and now has moved on to CEO of the County Commissioners. Elizabeth is a very important part of that group, and the chief shows up quite often to that group as well as a larger group. And I think it's important to stress that there needs to be a continuing partnership, not just what goes on with the police and some of the social service resources and mental health constituents and institutions and so forth, but also with the judiciary, the district attorney's office, the defense attorneys, you know, the probation, parole, and so forth. We have been working and continue to work. How can we figure out a way to divert people from the street to an appropriate crisis unit to deal with what is a behavior that's driven by a mental illness, sometimes and often co-occurring with drug-related issues, rather than have that person housed in jail, takes a bed space away from someone else and does that person virtually no good because they will end up being recogged out into the street. That's an ongoing effort, and the amount of resources which are available in this community are, as I think many places, simply insufficient. From the forum at Pacific University just 2 days ago on Wednesday, a large forum on mental illness in the public safety sector, and it was very, once again made clear that the police have very few places to take someone in a crisis situation. Either you spend several hours at an emergency room, and then shortly after you leave, after you've spent several hours, the person may be discharged. There isn't a 24/7 facility for people to be taken to. Cascadia walk-in has been fairly successful, but it's limited. So I think there's just a continuing effort to try to increase the number of resources and have police officers trained not just academically, but boots on the ground in how to identify, deal with, and perhaps divert these folks from going to jail. The second thing that I know many of you know we did was create a mental health court, again in partnership with all in the criminal justice system, so that some who have mental illness who are determined to be at a level where the state or district attorney's office is concerned that they would be a violent risk to the community, have this other track that's parallel to a track that would be a disposition of perhaps a conviction, but instead is tied to getting a mental health treatment and avoiding that type of conviction. So I just, I'm sorry if I talked too long, but I just wanted to make sure everyone knew that this is something that we embrace across the different entities that deal in the criminal justice system, and we're all very concerned and are always trying to find ways to deal with the problem up front rather than just always being in a responsive mode.
I think one of the things that's come out of the current budget crisis and the underfunding of whether it's law enforcement or social services is the fact that all of us realize we have to be better at what we do. We have to work smarter. We have to build relationships with non-traditional partners. When we were all, back 20 or 30 years ago, maybe the system didn't have to work that way. The police could be in their silo and just worry about law enforcement. You folks could just worry about people that had mental health issues. Somebody else could worry about drug addiction, and we didn't have to communicate very well. Now I can tell you we have to. We have to break down those barriers. We have to communicate well. It is going on. We have better relationships now with social service partners and non-traditional law enforcement partners than ever before, and we're only going to build on that.
Sure, Mr. I was at the swearing-in ceremony. It was great to see that there were 2 chaplains that were brought on. So you talked about the toll for officers, law enforcement, PPP. How do you console or deal with that when officers go out, they're the first to respond, and things happen in a way that they would not like for them to have been? How do you respond to that and their mental well-being to keep getting up and doing what we've asked them to do?
Well, we have a good employee assistance program, and certainly when officers are involved in a deadly force incident, they have to see a counselor. That's part of our mandatory return to work process. We also take them, if they've been involved in a deadly force incident, we take them off the street for 30 days. Still in a supportive environment, but we don't just put them right back into the same environment that they were in when they got into a shooting. We do that because of information we got from officers that were involved in that. They said it was healthier for us to come back into maybe an administrative role and work our way back to where we were at. And so we're still developing policies around that. Certainly, sometimes, in these types of situations, officers can feel a little bit embattled, and I think that it's really healthy for the communities to support the officers and say, we really value what you do, and we know you do it in very difficult circumstances. You do it because we as a community need you there. Thank you. saying thank you to a police officer makes a big difference to them. They don't hear that enough. So those are things that we do in terms of just when officers are involved in traumatic incidents. We monitor how many they have, because it's not just these deadly force things, but it's the accidents where someone's killed and police officers on scene and someone's died, or the death investigations or the child abuse investigations. They do take a professional toll on officers, and we have to be mindful of that. Constantly checking people's welfare and making sure that they have the support they need. I encourage officers to have healthy pursuits outside of work, like a band or a triathlon or things like that, but having a good support network. So, as Antoinette said, we've brought in chaplains, having a faith community. If officers want to engage that faith community, there's support there as well.
Before I came to this meeting, I was talking to a colleague about where I was headed for lunch, and he mentioned police shootings, and we started talking about the difference between police interviewing with mentally ill and counselors interviewing with mentally ill. He asked, how come therapists don't shoot their clients? Well, that's their guns, but what I came down to is that our mindset is different because we don't have a weapon on us. And so when we go into an intervention, we're going with it's not just the intervention, but it's the mindset that I think is different. And at times the outcome is different because of that. Because of our mindset, we're able to de-escalate somebody without using force. And I'm wondering, I know that you guys join with other mental health agencies in the CIT trainings, and you talk about education of mentally ill. I imagine you talk about some of the interventions. My curiosity is, how much is taught to police officers of the mindset of an intervention, of the nature of how you do it, not just, this is how you de-escalate somebody, but what is my mind frame going into that? Is my first thing to draw my weapon and show that sign of force, or is it I'm going in with the mindset of I need to join with this person, understand where they're at, and go from there and de-escalate in a way that is nonviolent.
Do you want to talk about our CIT training and how we educate all our officers?
Yeah, so I'll see if I can address that. So I think you're bringing up a really good point. In our CIT training, which I helped develop along with other people, and I'm also one of the trainers, it's not just de-escalating. We spent a lot of time in the training helping officers understand what is the mindset also of the person that they may be interacting with. So if someone is in a crisis, any crisis, you don't have to be mentally ill. When you're in a crisis, you're going to hear things differently. You might see things differently. You might not notice commands that are being given to you. So we talk to the officers about the mindset of the person. And when they get, I'm part of the training division, so when they also then learn about patrol tactics, just police officer tactics, one of the things the patrol tactics instructor talks about, I'm a mental health professional, I don't talk to officers about patrol tactics. The patrol tactics instructor talks to them about mindset. He has a whole, big piece of his training, which is all about officer mindset. And it's not just mindset tactically, it's everything from what's the person doing, reading all those little cues about where is this person at. A lot of police work, in my outsider looking in the training, is reading the person, where are they at, what is their intent, what are you noticing. It's a lot about what are you noticing. And then we give them information about mental illness, which provides another filter. So now in addition to, everybody's not a criminal, you have all these different filters. And one of the filters is mental illness. And so I hope that with our training and with the fact that how I've partnered with our patrol tactics folks, that when an officer shows up at the scene, one of the questions they ask themselves is this person mentally ill? Are they high on something? That has got to be one of the questions they ask. And I think that's the change that's happening. I'm not going to stand here and tell you every officer does that, but that's where we're going. That's what we hope.
And the last piece to that is that, the incidents we talked about today, the people were armed. They had weapons. They were threatening the community already, so it wasn't a static environment. The officers are being dispatched to a call where someone's armed, threatening someone else. So that kind of changes a little bit different from the clinical setting where you may have more control or the person's not armed. I would hope that you wouldn't go into, you know, your office knowing that that person's got a gun and is threatening to harm you. And that may put you at risk in a situation or a community member at risk that we don't want.
I have been in people's apartments where knowingly that they have a weapon. And again, it's, for me, it's the mindset of, it's also knowing what tools I have, but it's the mindset of going in. So instances like, you know, I would imagine a police officer would have fired. I got chased out of an apartment with a 4-foot sword.
You're lucky you ran fast.
Quick on my feet.
I just wanted to say thank you so much for allowing me to come today. It is, again, very humbling to be your chief of police, and I want to thank you very much for the opportunity.
Well, we want to thank you summed it up. I think the tone, at least I can speak for, I think, my peer mental health organizations, is we absolutely see this as a partnership, and we will do whatever we can for all the sectors here, you know, judicial, corrections, everybody working together. I do think there's really good things happening in our community. There's tragedies. I mean, all of us, you know, we can't deny that. We see that nationally, but we have to, for me, to keep up and keep going, like this guy did all those years, you have to focus on the positive pieces, the hope, and it starts in conversations like this. So I just invite us all to continue and keep a good dialogue and partnership across sectors. So we thank you all for being here, and look forward, and again, thank you.
Thank you.
Thanks, everybody, for coming.